Researchers in Germany have discovered an antibody that could be a huge leap forward in the fight against HIV. Deutsche Welle correspondent Kassandra Sundt joins us now from Berlin. Kassandra, g'day. So what is this antibody?
Hi, Joe. Thanks for having me. So this all started when researchers here in Germany started looking at blood samples from 32 people who were living with HIV. But these people had all had particularly strong and effective antibody responses to the virus, all on their own without any medical intervention. What the researchers at the University Hospital of Cologne did was take those blood samples, then start looking at 800 different antibodies. They wanted to look at each antibody's ability to neutralize HIV. And one antibody in particular, with the very catchy name of 04A06, stood out. This antibody was able to block a site where the virus binds to the cell when it infects a person, which means it prevents HIV from entering the body's cell. That's important because once a virus is able to enter a cell, it reprograms the cell to reproduce the virus, and that weakens the immune system in the long term.
And so what's the testing been like so far with this antibody, and what are the next steps with the treatment?
In the experiments with mice that were infected with HIV, 04A06 was able to neutralize most HIV infections. The researchers ran experiments with 340 variations of HIV, including some forms that were resistant to other antibodies. But the really astounding part here, Joe, was that this antibody was able to neutralize 98% of the HIV variants that were tested. The researchers here in Germany say that means it may be able to help people who are already infected with HIV because it blocks the virus's access to cells. And they hope it could also prevent HIV infections because it intercepts viruses before they can infect cells and multiply in the body. So more testing is required, including clinical trials, but scientists think that this newly discovered antibody could act as, quote, passive immunization. And active immunization would be a little different. It would enable the body to produce antibodies itself. And just a reminder that currently there are no HIV vaccines as of yet.
Yeah, and so there have been conversations about treatments and potential cures for HIV for years. What's the state of HIV treatment at the moment?
Right. In terms of research, studies based on mRNA technology are still ongoing. That's the same kind of technology that gave us many COVID-19 vaccines. Researchers have been aiming to stimulate an immune response with a protein taken from HIV, but that's proving to be a challenge with such an active virus like HIV. And even though it's been over 40 years since HIV was officially discovered, there is still not a cure or a vaccine. But there are really effective treatments, pre-exposure drugs, and educational campaigns that have all resulted in fewer deaths and more people living longer, healthier lives, even with HIV. But the fact of the matter is that people are still dying. UNAIDS says that last year, 630,000 people were estimated to have died from HIV-related complications around the world. But when we're talking about people living with HIV, there's an estimated 30,000 people in Australia living with the virus at last count. So with this new treatment and ongoing research, even more effective treatments seem to be on the horizon.
Okay, Kassandra Sundt reporting there from Berlin.